Good morning, everybody. I am Dr. Rakshak Anand, MDS Oral and Maxillofacial Surgery. Today I am giving the detailed discussion about the various instruments used in the extraction in dental surgery. As you can see that we have the forceps for the maxilla as well as for the mandible. For maxilla, the main difference is in regard to the mandible forcep is that the beaks, they are in line with the handle, whereas in the mandible the beaks, they are perpendicular to the handle of the forceps. So for each forceps is unique for the each tooth, right? For maxillary anteriors we use basically this forceps, in which when we approximate the beaks of the forceps, they will join, right? And in addition to that, you can see that there is no pointed end in the beaks of the anterior forceps. Now the difference between the anterior and the premolar forceps for the maxilla is that in premolar forceps, when beaks are approximated, there is always a gap between the beaks, whereas in anterior forceps, when the beaks are approximated, there is no gap. So this is for the anterior and this is for the premolar. Now next important forceps is for the maxillary molars. For maxillary molars, as you can see, if you compare the three forceps, you can see that there is a pointed beak on one side of the forceps. Now this molar forceps, it is different for the right side and for the left side of the molars, right? Now how you will recognize whether the forceps is for the right side or the left side? The first of all, this curvature of the handle of the curvature is firmly held in your palms, right? And then you have to decide whether is it for the right side or the left side. For the right side, as you can see, we have for the first molar we have mesiobuccal and distobuccal roots. So this pointed beak goes to the buccal side, right? And this pointed beak goes for, and this flat end of the forceps, it goes on the palatal side, right? So this is basically for the first quadrant of the bayonet forceps. The bayonet forceps is for the removal of the root stumps of the maxillary molars, right? Then another maxillary forceps of important consideration is this forceps, which is basically used for the removal of the upper third molars, right? This elongated end of the beaks, it easily gets adapted to the third molars, and the third molars can be easily removed with the help of this forceps. Then the mandibular forceps, the same is the case with the anterior and the posterior forceps. In anterior forceps, the beaks, they are joined on approximation, whereas the premolar, the beaks are not approximated when they are joined. The molar forceps for the mandible is same for the right and the left side. There is no demarcation between the right and the left side of the mandibular molars. As you can see, there is mesial and distal root in the first molar, and both the beaks, they are pointed as compared to one of the flat beaks in the maxillary molar forceps. Then another set of instruments used for the extraction is the elevators, right? Elevators is basically the most important elevator which is used is the Coupland elevator. This is the Coupland elevator. It is recognized by the scoop shade of its end, right? So these are the different Coupland elevators which are used in the removal of the teeth, right? These all are the different shapes of the Coupland elevators. The only thing is that in the elevator you have to identify if it is scooped end, then it is the Coupland elevators. Now another important elevator is the criers. So these are the set of criers. These are basically used for the removal of the root stumps of the mandibular molars when the crown is grossly decayed. Another set of instruments is the root apexo elevators. These are also used for the broken root stumps in the teeth. They can be easily removed with the help of this forceps. So similar to criers, there are another set of elevators known as T cracks. As you can see that it is a shape of a T. This is basically again used for the removal of the root stumps of the third molars and in the impaction cases of the third molars. Then another important instrument is the, as you can see, it is a Warwick James elevator, also known as hockey stick elevator. You can see the shape of the elevator, it is just like a hockey stick. That is why it is given the same name. It is also used with wheel and axle principle for the removal of the root stumps of the molars. So this is all about the different extraction forceps and elevators used in the oral surgery. Thank you.